The common bacterial, viral, and parasitic diseases of calves, the risk factors, the control, and prevention of diseases. So in calves, the most important bacteria are E. coli, Salmonella, and Staphylococcus. And the most important viruses are Rota, Corona, and Adenovirus. And the most important parasites are Cryptosporidium and Coccidiosis. For E. coli, the infection happens through feces at calving. At day 1, this is so important, they can get endotoxic shock. So the calves will have a really big fever and they'll have anorexia and death. After day 1, so at day 2 to day 7, so the first week, they can get endotoxins, and these cause yellowish diarrhea and dehydration. And then under 2 weeks, so over 1 week but under 2 weeks old, they can get enterohemorrhagic strains, which causes mild dysentery. If there are a lot of cases of this on the farm, you need to check the colostrum and the hygiene. To treat these young calves, give intensive therapy, and you can give immunoglycosides. But the most important thing is vaccination 2 times before calving. The next bacteria is Salmonella. This can cause zoonosis. It occurs in calves around 3 days old to 4 weeks old. It is less severe in adults. It starts in the calves, but then it can go to the adults as well. For the treatment, give fluid therapy and NSAIDs. For the rotavirus, this occurs when the calves are 3 days old to 3 weeks old. It peaks at 2 weeks. The infection occurs orally with feces, and it's less severe than the coronavirus. For prevention, you need to have vaccination 2 times before calving. For the coronavirus, this also occurs at around 3 days to 3 weeks old. It happens in the winter especially, and the early spring. It enters the body orally, and it causes profuse yellowish diarrhea and exocosis, and you need to vaccinate the mother 2 times before calving. For Cryptosporidium, this protozoic parasite is zoonotic, and it occurs in the calves at around 1 to 3 weeks old. It enters the body orally and affects the calves directly. The parasite adheres to the microvilli and causes light yellow or green diarrhea. You need to treat the whole herd with halofugione. This decreases shedding. Cryptosporidium can survive in the environment for a very long time, and it's also resistant to disinfectants. There is no vaccine, and there's a high morbidity and low mortality. You need to have hygiene with all in, all out. For coccidiosis, this occurs in calves under 4 weeks old. The infection happens during 1 week, and the incubation period is 3 weeks. The treatment for this is sulfonamides, and you need to have disinfection and all in, all out. The risk factors for these infections are feces from the dam and poor hygiene, so poor personal hygiene, environmental hygiene, or infected bedding, as well as dystocia or dam metabolic disorders or immunosuppressive diseases such as bovine viral diarrhea. For diagnosing, you can do a quick test called Bovid-5. It tests for E. coli, Giardia, Cryptosporidium, and rotavirus. You can also do lab tests, culture, parasitology, and antibiotic susceptibility testing. To prevent this, you need to increase newborn vitality by having appropriate dam feeding to prevent metabolic disorders and appropriate calving, and ensure proper climate conditions. And also decrease the germ load, have good hygiene and separate sick animals, and then have disinfectants. For passive immunity, have high quality colostrum, and also have proper grouping of pregnant animals, and have proper dam feeding and vaccinate the dams 2 times before calving for E. coli and rotavirus. And you can also increase the intestinal flora with prebiotics and probiotics.